Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Hello, everybody, and welcome to Daily with Doc and Becca. My name is Becca Dukes, and I am so excited as we have the holidays coming up and all of the things that brings with the joy and the comfort. And in that joy and comfort sometimes include some of those comfort foods that maybe aren't eaten all year long, but maybe we need to think about that. So we're going to be thinking about that a little bit as we are making the holidays sweet, but not raising our blood sugar, folks, here on Daily with Doc and Becca. Now, this program is being sponsored by dailywithdoc.com. On dailywithdoc.com, you're going to find a good foods, bad foods list. You're going to find replays from our previous presentations and Zooms and podcasts, whatever you want to call this. And you're also going to find on there other articles that help you as an individual get information that you can use in your everyday life. So it's not just some technical jargon that you may never use, kind of like what we talk about algebra. Well, I used a lot of algebra and statistics, so pay attention, kids. But we are also going to be talking about how each and every day we need to be mindful about what we put in our body and what we can do to support our body in every situation. So, especially here in the holidays, I love baking. And we're going to talk about some of those things, alternatives also that you can do in your baking to make it healthier for you and your family and those you love. So if you were invited by somebody specific, we want to make sure that you get back with the person that shared this program with you. They cared enough to share this program, so care enough and tell them thank you for taking the time. They are also going to be the person that you get back to with any questions. All right. So as we have our shows, we get lots of questions in the chat. If you're watching us on a live stream off of Zoom and you have some questions, you're more than welcome to put those questions in that chat if that is available. Also, let us know where you're joining us from. Now, if you'd like to join us here live in the Zoom, and if you're here already, make sure that you have that chat open. The information that is being spoken, Marilyn does a tremendous job in doing transcription in putting that in the chat as well, including recommendations as we go through the show that Dr. Wallach makes for individuals with the certain health conditions and symptoms. So we do go by symptoms and conditions, not necessarily medical jargon. With that being said, we are here Monday through Friday from 12 to 1 p.m. Pacific time. That's 2 Mountain, 3 Central, and 1 Mountain, 2 Central, 3 Eastern. And we are here for you and for you, the people that you love. So make sure you share this program with them because, folks, there's so much information out on the internet. Some of it, okay, no, I'm not going to say some of it. Most of it, when it comes to nutrition, they're just mocking what the doctor that we have on here with us has been saying for over 3 decades. Let's say over 4 decades, maybe even 5 decades.
5.
5? Okay. So has it been 5 decades since you taught nutrition, Dr. Wallach, at the Naturopathic College in Oregon?
Oh, yeah. I started teaching in 1965.
Wow. So, folks, the man that I'm going to bring on the screen with me right now is Dr. Joel Wallach. Now, Dr. Joel Wallach has a Bachelor of Science in Plant and Soil Sciences. He is also a Doctor of Veterinary Medicine. He has 3 postdoctorates in pathology. He is also a naturopathic physician. Now, through all of his experience, he has been able to be very instrumental in saving the white rhino as a head veterinarian on that expedition with Marlin Perkins of Mutual Omaha's Wild Kingdom. He has also identified the cause of liver cancer in bears in zoos around the world. So if they're around the world, chances are they're not related. And they're different species of bears, but they're all being fed the same thing and coming up with liver cancer. He figured it out in a very short amount of time. They made changes. 5 days. Like I said, a very short amount of time, Doc. 5 days figuring out what was the cause and even identified the aspergillus that was on the peanuts that were being fed to the bears, which then includes aflatoxin, which is cancer causing. So, folks, recently there was something that was on the news. News alert, aflatoxin found in peanuts causes cancer. Doc's been saying that for 50 years. It's nothing new, folks. So let's make sure that the person that is bringing this information gets the credit. And Dr. Wallach, you have not gotten nearly the amount of credit that you should, even though you have received the Klaus Schwartz Award in 2011. You also received the award from United Nations.
Lifetime Achievement Award from the United Nations.
A Lifetime Achievement Award, absolutely. They should be given award for individuals who sue the FDA 8 times and win. That should be an award in itself. Some of the things that others get Nobel Peace Prizes for, Dr. Wallach, are just ridiculous in comparison to what you have done for humanity. So I want to make sure that everybody gets this information and is able to apply it, because that's what we do. We provide information that is applicable to everybody around the world. So, Dr. Wallach, and for those of you who don't know, cystic fibrosis was said to be a human condition, and it was said to be genetic. He found the first non-human case of cystic fibrosis in a Rhesus monkey. And actually, almost all of the young monkeys in that community were not related, and they all had cystic fibrosis. It was the diet. But they didn't want to hear that, so they fired him. And that actually, Dr. Wallach, led you on to such greater accomplishments, bigger and better things, as you took the place of Jeffrey Bland, who is a very well-known individual in the nutrition realm. He was the last PhD that was received under Linus Pauling, who both of you are students of Linus Pauling.
Yes.
You took his position at the Naturopathic College in Oregon and started teaching nutrition. You didn't replace
National College of Naturopathic Medicine, NCNM.
There you go. National College of Naturopathic Medicine, which has changed names since, but Dr. Wallach, you have learned from some of the best. You have created, and you're one of the co-founding fathers of the science of epigenetics. And Jeffrey Bland even wrote the foreword for epigenetics. This is epigenetics. This is one of Dr. Wallach's books. This is a Reese monkey that I was talking about earlier. I mean, just so endearing, Dr. Wallach. And it also shows you with the Klaus Schwartz Award being presented by, who's this, Jim? Dear Held Schwartz?
Huh?
So, yes. So, folks, we're in great company right now as we are students of an amazing teacher, doctor, lecturer, researcher. And Dr. Wallach, what goes into getting a postdoctorate in pathology?
Well, you have to be there every day, 7 days a week, and you're doing autopsies and you're looking at slides of the tissues, and you're learning what's going on in pathology. And I actually received 2 nominations for a Nobel Prize because of all that, and was very, very honored for that. And of course, everybody on the Nobel Prize committee was a medical doctor. And so when an naturopathic doctor came up to actually get the award after I was nominated for it, they said, this guy's not a medical doctor. He's an ND. We're not going to give him the Nobel Prize. But just being nominated was a beautiful thing. I cannot thank those teams enough for nominating me for the Nobel Prize. It just tells you that they appreciated that I was doing something very, very special for humanity.
Well, even though you didn't get the actual Nobel Prize, I think you have done more for humanity, like I said earlier, than any one person, Dr. Wallach. And that's why I believe so much in this message, because of the changes that it made in my own life and those that I'm seeing in my clients each and every day. I mean, there's nothing greater than getting a phone call from a client that just is so excited because their blood pressure is normal without pharmaceuticals, or they don't have to do kidney dialysis 3 days a week anymore, or they have a kiddo who wasn't able to pay attention in school, now able to function. And one particular one on the autism spectrum struggled during high school. We got him on the program. He went to college and graduated from college with honors. Folks, that's the importance and what quality nutrition can do for you and those in your family. So, Dr. Wallach, let's go to blood sugar. Okay. As we're coming into the holidays, there's cookies, there's cakes, there's pies, there's sugar added to even the good foods like sweet potatoes, making it so that it's actually on the harmful side to our body. What can we do, Dr. Wallach? I mean, of course, there's foods that we can substitute out, and all of those cookies, cakes, pies, what's their main ingredient?
This is very easy. Yeah, this is very easy to protect yourself. Obviously, just not eat anything with sugar in it, but that's not going to happen with all the holidays and all the treats and desserts and cakes and pies and drinks and so forth. And this way, we came up with Sweeties, which has the nutrients in it that help control blood sugar. We take people who have been treated as a diabetic by the medical profession for 25 years. In 2 weeks' time on this product and the 90, you just can't use this by itself. This goes along with the 90. Okay. It could be the Healthy Start Pack. There you go. The Healthy Start Pack, or the Healthy Brain and Heart Pack, or the Healthy Bone and Joint Pack. Any one of those 3 total programs get all the 90 essential nutrients, 16 minerals, 16 vitamins, 12 omega 3 fatty acids. You can add the Sweeties. Okay, and I've done that when we first came out with it. I've been taking 3 of those twice a day for like 30 years. And it helps you control your blood sugar And if you, like I say, we have so many diabetics have been injecting insulin for like 25 years. And then in 2 to 4 weeks, they're not a diabetic anymore because they're taking the Sweeties, which is what was missing. It was a deficiency disease, not a genetic thing. And then, of course, we have also to go along
Well,
with
hold
the
on.
Sweeties.
Can we go back to that statement that you just made? Diabetes is not a genetic thing. It's not something that because your grandmother and your mother and your father and grandfather, one of them had it, that you're going to get it.
No, see, it has to do with if everybody in the family is eating grandma's recipes and they have a disease, it's grandma's recipe that caused it. It's not the genetics. There's no genetics that causes diabetes. Okay. And then, of course, it's very, very simple. Like I say, we take people who have spent most of their life, 25, 30 years as diabetic, and they're so excited because they can inject insulin once or twice a day. But then they're failing, their body is failing because they're missing these nutrients and they can't store energy. And so that's why we came up with the Sweeties and the Ocean's Gold for the thyroid, the Sweeties for your pancreas and the blood sugar levels. And it works 99.9% of the time. The only time it doesn't work is somebody's didn't give up the bad foods and they cannot absorb the nutrients in Sweeties or Ocean's Gold because they've killed the villi in their intestines. Instead of looking like a shag rug, the villi are gone. Okay, there you go.
So go ahead and finish about the villi instead of being like a shag rug. And this is the inside the intestines, folks.
Yeah,
So I don't know.
The intestine is a tube, but the tube is lined with these finger-like projections called villi. You look it up in any dictionary or just ask Siri. Okay, what is villi? V-I-L-L-I-E. Okay, what are villi? They're the finger-like projections that take and add 90% more surface area for absorption. And they also have little villi, little hairs on them, okay, that help move food along with the muscles, okay? And so this is something that when you eat gluten, wheat, barley, rye, and oats, and buckwheat pancakes, we used to eat buckwheat pancakes on like one Saturday or Sunday a month. And then once I found out about the buckwheat causing the same thing as wheat, barley, rye, and oats, everybody stopped eating buckwheat, okay? And of course, that's an English thing. It started out in England, was the buckwheat kind of thing. But Sweeties, Ocean's Gold, but that's, again, not to replace the 90 essential nutrients. These are add-ons. And when the holidays are over, just keep taking them. Don't stop taking them, and you'll add many healthful years to your life if you take these things because they will help you control blood sugar. They'll help you control energy levels and storage of energy and the ability to acquire it when you need it. Those two products are very, very useful in modern times. And of course, we have 27 best-selling books. And we have this new tool out now. Okay, it's a DVD. It's not a CD, it's a DVD. And this was actually encouraged by Charlie Ward, who is probably one of the biggest people in Europe, maybe the world, when it comes to news and health information and so forth. And he came and listened to some of my lectures and so forth. And we did some things together. And so he encouraged me to find out what's going on with AI, artificial intelligence. And artificial intelligence, when you look at your thermostat in your wall, that's AI. Because when you're asleep, and let's say you have it set for 75, and it gets cold outside, and the temperature in the house drops down to 60, it kicks in. So it's in the thermostat, and the heater turns on, brings it back up to 75. Or if it's too hot in the summertime, and it goes up to 80, it brings it back down to 75 or 70, okay, with the cooling system, and you're asleep. That's AI. That's artificial intelligence doing that. You didn't have to sit there and do the switch, every hour and all that kind of stuff. Same way with fences. They didn't have to stay up all night to keep the horse in the backyard. Okay, they just put a fence around the house and let them stay in there. So that was kind of an AI thing. And there's AI things that are good. What started doing bad things with AI was physician said, well, this is easy. We'll just do AI for patients. And but when a patient comes in with diabetes, they don't just have diabetes. They have high blood pressure. They have arthritis. They have osteoporosis. They have liver problems. They have brain problems. They have eye problems. And you're just giving them a prescription drug to deal with the diabetes. All these other things continue on, and they're going to die 10 to 15 to 20 years early because you haven't really fixed the basic stuff. And so this is where the AI thing in medicine, you have to deal with all of the problems going on, not just the one that the patient is complaining about. You have to deal with it all. And this little, it's only a half hour long, okay? And it talks about the AI. And the one that came out first was Dead Doctors Don't Lie. And that book, when it came out, I don't know, 30 years ago, we sold, before the book came out, we had audio tapes. We didn't have CDs yet. We had audio tapes. We sold 40 million copies in 81 countries of the audio tape, Dead Doctors Don't Lie. Then the book came out, Dead Doctors Don't Lie. And we sold 347 million copies of that one. Is still flying out the door by the cases and the bags and 10s and 20s. Okay, Dead Doctors Don't Lie. And then we came out with a big DVD. This is 2 hours and, let's see, 2 hours and 10 minutes long. Dead Doctors Don't Lie. Someone should go to jail. That's Dr. Milan's favorite subtitle. Someone should go to jail for this. Okay. And this is a beautiful thing. Just to have on your desk under glass. Don't just leave it on the desk and somebody will walk away with it, but put it under glass so they can't take it. But there it is. That's what it looks like. 2 hours and 8 minutes. It's a beautiful, it's my presentation. It's my presentation. It goes back 10, 15 years ago. And of course, you get a nice discount when you buy more. And of course, then the Dead Doctors Don't Lie CD. And now we have the AI thing in a DVD. Okay. And so we have all this information that will help you get through this stuff, because we know that none of this is genetic. It's all nutritional deficiencies, and doctors didn't get the training. So when they saw 5 people in the family with the same disease, oh, it's got to be genetic. You got all these people in your family with it. It's got to be genetic. No, that's because they're all eating the same diet, drinking the same water, and so forth. And the example I can give you that's right now is the Pakistanis, the Hunzas in the Himalayan mountains. Their average lifespan is 120. They have no medical doctors in the Hunza communities, no medical doctors, but they do live in the land flowing with milk and honey, which is in the old Bible 2,000 years ago. Talked about the land flowing with milk and honey, where people live to be 120, 150, 300, 400, 500, because they're getting all these minerals coming down from the mountains, and it looked like milk coming down on the side of the mountains because of the white powder, the glaciers grinding up the rocks into dust, and that white dust getting in the creeks coming down the side of the mountains from a half a mile away. It looked like milk coming down the side of the mountains. And that's where they got the term, the land flowing with milk and honey. The minerals getting down into the mountains, into the valleys, and the bees were there because there's more flowers, more bees, more honey. And so that's why it was the land flowing with milk and honey. They didn't know why, but they knew there was something special about those places. And that's why it was a God's thing, which is true.
Yeah, the Old Testament, Dr. Wallach, in the beginning, they were living till 900 plus years.
Yes.
Very commonly, well into the 600s and 500s and 400s.
Yes.
And over time,
that's because they were getting the nutrients coming down from the sides of those mountains. And so when you knew that in 400 miles away, those people are living 5 times longer than the people in your community, people would move there, just like the Pakistanis, okay, and the Hunzas. People are flocking to go there because they're living so long now. In the United States, the average lifespan of an American is 75.7. The average lifespan of a white medical doctor in America is 75.7. The average lifespan of a black medical doctor in America is 65.7. Because they're just eating food. Plants only need 3 minerals. We need 60. So you must supplement, because you're not living in the land flowing with milk and honey. You have to create your own environment in your home and your workplace. And that's why we came out with all these products.
Well, Dr. Wallach, I am so thankful that you did, because now we know that we're getting in our body, when we intentionally supplement, we're getting what the body absolutely needs. And through all of those autopsies, almost 30,000 autopsies on 452 different species, you were able to identify the essential, meaning our body can't make it. They have to be intentionally taken. And that's what you and the formulators of the longevity products have done. You have intentionally made sure that those 90 essential nutrients are in every dose.
That's right. The Healthy Brain and Heart Pack, the Healthy Start Pack, the Healthy Bone and Joint Pack. Okay, those three contain the 90. Okay. And then, of course, we have, I think it's 2,500 secret sauces. 2,500.
We have fewer than that. We have fewer than that, Dr. Wallach, because but because some of that 2,500 has to do with what I put on my face, Doc. Mm-hmm. Come on. Not everybody can wear the same colors I wear, and I can't wear the same colors everybody else wears. So we have to have a lot of color. But I love the fact that it also is mineral based, and is just, I know that I'm putting stuff that's healthy for my skin on my skin, which brings me to the plant-derived minerals, Dr. Wallach. So plant-derived minerals was one of the big products that you had started to talk about. You have the bottle there. If you don't, I probably do behind me. But I have my spray bottle, Dr. Wallach, filled with plant-derived minerals. When I get out of the shower, I spray my body. When I just want to freshen up, I spray my face. I spray it in my hair to get that like beach look type thing. Yeah, Dr. Wallach is showing the plant-derived minerals on the back. It lists all of the elements that are found within that one bottle, and they're colloidal form, meaning
plant-derived colloidal minerals.
Meaning they get absorbed like instantly. The body doesn't have to break down rocks. It's already been decomposed through the plants and in a prehistoric vein where it's hidden in Utah, free from contaminants, which I think is fantastic. Put in that bottle, suspended in liquid, which makes it super easy for us to take internally and to spray on the body externally.
And we have contracts with the mines to produce this. Now you can buy one bottle there, but you can't fill your truck from there, because we have a contract that they can't sell in quantity to anybody else but us. This has been going on for like 25 years. Okay. Because we knew that some big corporation would come swooping in there and kick us out of there and take over and everything. And we didn't
ruin a good thing. Ruin a good thing. Let's not ruin a good thing. Let's continue to help people, Dr. Wallach. Now, as we're talking, we've got all these questions coming in. And one of the questions says, are you saying no Christmas cookies? Well, one thing about taking the 90 essential nutrients and the plant-derived minerals and the sweeties, that reduces your cravings for them, so you can have more control over what you put in your body when it does come to that whole table full of goodies. So if you're eating all those goodies and you're on the 90 essential nutrients, it's because you told your brain it's okay. It's not that your body's craving it. Your brain has been programmed to it. So definitely want to reduce sugar. We've got Dr. Wallach is holding up the Rebound, which, folks, if you're craving something that's sweet, Rebound is a great drink powder that you can mix in your drink. Gives you hydration. It's the best electrofuel. Not electrofuel.
Gives you all your vitamins. It gives
electrolytes. Electrolytes. So electrofuel is another one of the products that Longevity offers. But you're getting all your minerals, you're getting some vitamins in there, helps with energy. And a lot of people, Dr. Wallach, use sugar as energy, when in fact, fat is a much better energy, and it lasts longer without having a high and a crash and not affecting your blood sugar. So just something to think about, folks. And as we're going through the different things that are on that table, wheat, barley, rye, and oats are heavy. in the baking process, Dr. Wallach, for common practice. But there are so many different amazing gluten-free flours that you can do a cup for cup and just start substituting out as you're baking. Substitute out that regular all-purpose wheat flour or oat flour. Don't use oats. It's just as bad as wheat, no matter what they say. And you want the good cholesterol to stay there. You don't want the oat and the fibers pushing it through the system, not allowing it to be utilized by the liver so that you can support the brain.
Why is cholesterol so valuable?
Because cholesterol is needed, Dr. Wallach, to make the protective coating of the brain and the myelin sheath and hormones, whether it's estrogen or testosterone. It's needed in so many different functions of the body. So if you cut it out, those other functions of the body are getting cut out too.
Yeah, cholesterol is one of your best friends. Gives you good sex life, gives you good brain and spinal cord function and nerve function. Doctors do so many surgical procedures because there's osteoporosis of the skull, squeezing those 12 pairs of cranial nerves, and you're not getting all the information from the brain past the skull. It's all locked in there. And doctors want to do surgery and all this kind of stuff, when really you get on the nutritional program and take everything perfectly, and you can actually rebuild that skull, go take it back to normal. It'll take you a couple of months, but you'll see benefit within a couple of weeks. And it just gets better and better and better by the time that's why I always say, give us 90 days, because I found out that 99.9% of the time, you're going to get what you're going to get before 90 days comes along. Okay.
Or you're going to have a good start on it. Dr. Wallach, I mean, that first 90 days, I lost 20 pounds. I no longer had all of the pain throughout my body. I no longer had pain even in my hip capsule. I no longer was having shingles outbreaks in my eyes. And I kept going. And I lost another 70 pounds. And my blood sugar is under control. My hair looks great. My skin looks great. And your stamina
and your strength, and to be able to do physical things.
Absolutely.
It's a beautiful thing.
Yeah. I mean, I'm able to take care of my mama. I'm able to move. Who needs a man? Not me. But I can move. I can do anything and everything that's needed in life and not be held back. And I just thank you, Dr. Wallach, because there was not a time that, I mean, there was a time where I couldn't say that.
Now, what did doctors tell you when you were really having all these problems? What did they tell you?
Well, they just pushed me off to pain management, Dr. Wallach. They wanted to give me more and more pharmaceuticals to mask the pain, and I was allergic to most of them. So their option would not work for me. And I wasn't accepting the fact that pain management was all there was left for me. So, I mean, broke my back, herniated discs, degenerative bone and disc disease, all these different things. I'm like, there's got to be something. I shouldn't, I'm too young to feel this old. And this was at 30, Dr. Wallach. I didn't find you until I was 44. So, yeah. And then I had hormone issues after having a baby in my 40s. But hey, life is great. Dr. Wallach, my goodness, we have lots of questions coming in. The first one we want to go to is Patty. So Patty has been trying to find a way to raise her hand. Patty, can you unmute yourself?
Thank you so much. Sorry about that.
No worries.
I'm here with a friend, and I want him to kind of explain his health stuff. And I've been trying to get him on to do this. So I'm glad. Thank you for taking the time with us today. So go ahead.
Yeah, hello.
Yes, sir.
Tell him what's going on. I've
had a stroke in 2015, and then I had a recent stroke less than a year ago and was hospitalized for a month. And it was very difficult coming out of that one.
Numbness in the leg.
Yeah, my numbness and swelling in my leg hasn't gone down. It's gotten worse. Prior to the stroke, I had 2 previous heart attacks and was hospitalized, and they couldn't find out any information on They didn't give me any information in regards to why the heart attacks occurred. Only my hypertension has been very high up and down for years.
Okay, let's stop there. How old are you, sir?
I'm 64,
Okay, how much do you weigh?
197.
Okay, so I want you to get off all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, no barley, rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet ones got to go. Carbonation neutralizes your stomach acid, so you cannot digest food or absorb minerals. Then you said 195 pounds, 190 pounds, whatever it is.
Yeah.
I want you
Yeah.
to take 2 healthy brain heart packs per month. 2 healthy brain and heart packs per month. Take a full dose at breakfast, full dose at dinner time. Then I also want you to take 3 of our Ultimate Daily Classic tablets. Take 3 of those at breakfast, 3 at lunch, or at dinner time. They're going to help you get blood flowing into your brain, into your heart, into your liver, into your kidneys, so forth. And then you also need to take the, let's see here. Let's go ahead and take the Sweeties. Take 3 of those twice a day so you can control your sugar. We want you also to take the I-26. There, I was looking for that I-26, and that's going to manage the white matter in your brain and spinal cord and rebuild the brain and spinal cord. And that includes the optic nerve going to the eye and the veins coming back and the nerves coming back from the eye back into the brain. Okay.
What was that called? I-26?
I-26, yeah.
I-26,
And,
okay.
okay, and they're chewables. I
Okay.
like the chewables. I take the French vanillas. They also come in banana coconut, which are one of our best-selling ones.
Okay.
And take 3 of those chewables twice a day. You could even take 3 times a day if you want. Okay. And let's see here. What did I leave out? Becca, did I leave anything out?
Did you mention the synaptive, Dr. Wallach?
Oh, synaptive. Yeah, that'll help the brain talk to everything out there in the body and everything in the body talk back to the brain. And also for energy, you want to use the rebound. I take 2 of these a day. I take 1 before breakfast. I take 1 before lunch. You don't want to take it after 5 o'clock because it'll keep you up all night. But this has the vitamins and minerals and amino acids and stuff like that you won't get anyplace else in any energy drink. And this was actually made for Theo Ratliff, one of our best basketball players. Okay, and we did great things for him. His career was over. We rebuilt him, and he wanted an energy drink, so we came up with a rebound for him. And it comes in boxes of 30. And if you're going to be taking 2 a day at your body weight, you need 2 of these boxes of rebound a month. And I have to pay for it like everybody else. I don't get it for free.
Right. Okay.
I'm having a lot of retention problems in my bladder also.
Yeah, well, that's where, again, the I-26 is going to help you. There's the rebuilding your skull is going to help you because the vagus nerve, the 10th cranial nerve, is formed in the brain, comes through the skull, goes all the way down to your toes and sends out branches all the way down. And that's why your doctor can't figure out why you're having all these problems, because it's happening in the 10th cranial nerve, because the skull is squeezing that 10th cranial nerve, and they'll cut your feet off if you have pain and you keep complaining about it. They'll just cut your feet off. You won't have pain in your feet anymore because your feet are in the garbage can.
Right. It's terrible.
Okay, but if you want to rebuild the brain, you want to rebuild the skull, doctors do not get trained on this. They laugh. You say, oh, they say, I have, Dr. Wallach says I have osteoporosis of the skull. And they'll slap their leg and laugh and say, get out of my office. There's no such thing as osteoporosis of the skull. No, osteoporosis of the skull is a very, very common thing. Babies can be born with it. Young kids, there's a disease called Friedreich's ataxia. Friedreich's ataxia is kind of a paralysis. It's a kind of a paralysis. And so there was a set of twins. They weren't identical twins. It was just in the newspaper just like a week ago. It was in, and also Fox News. And I tried to find a phone number of the town they were from and their last name. They just said their first names. And 3 hours later, they weren't on the Fox News anymore. So they probably had so many calls, they just dropped that because it didn't have any answers. Well, Friedreich's ataxia is part of the osteoporosis of the skull, squeezing the 12 pairs of cranial nerves, including that 10th cranial nerve, also partly due to the myelin, the white matter of the brain and spinal cord going away. And that's why we have the book, It's All in Your Head. We do have a CD that goes along with it for the spinal cord. Okay. And it goes into, there you go. We want to turn to page 6, Becca.
Can we order that from the website?
Yeah, top one is normal. It's a 1/4 inch thick. The bottom one, they've taken the top of the skull off and they're looking at the brain, but you see that the skull is 1.5 inches to 2 inches thick. That's osteoporosis of the skull. The bone has been replaced by scar tissue and squeezing all those tunnels. Go ahead, flip the page. Flip the page. Now you're looking at the bottom of the brain, the human brain. You're seeing all those 12 cranial nerves going out to all the different tissues. And in your left hand, I guess it is. Yeah, there you go. You're seeing a white bar, a gray bar, a white bar, a gray bar. Each one of those represents a chapter. It goes into one of the cranial nerves, and it tells you and describes those tissues that each nerve is going to, and then tells you what you need to add to what secret sauces you need to add to the 90 essential nutrients. Don't just take the secret sauce because you're not going to get major benefit. You need to add the secret sauces to the 90 essential nutrients. The 90 essential nutrients is to your body biochemically as water is to your body, as oxygen is to your body. You must have it every day, every minute of the day. Okay. Don't skip the 90. And then you add these secret sauces for each of the problems, and you'll be amazed. In 2 to 4 weeks, I had this problem for 20 years and it went away in 4 weeks. Well, what do you think your doctor knew? Your doctor didn't know anything about this because they don't teach about osteoporosis of the skull in medical school.
And Patty, you had asked if you could get this on the website. Yes, Dr. Wallach does have it on his website. You can also find it on Amazon.
Oh, okay. Thank you.
Majority of Dr. Wallach's books.
Of course, the website is www.drjwallach.com, www.drjwallach.com. And you get a hold of these books and CDs and DVDs, and you can, what should I say, you can add many healthy years to your life. You can add much health to a life that's been corrupted by deficiencies and poor eating habits and where you live. And you're not living in an area that has glacial milk coming down the side of the mountain. You may only have 3 minerals in your food. Okay. And somebody who's living where there's glacial milk coming down the side of the mountain, they have 75 to 100 minerals in their food. There's a difference. So,
Dr. Wallach, we had a question in here and wanting you to expound on the American doctor's life expectancy. You said was 75.6, I believe. Now, there's a time, and sometimes it still holds true, where you had said that a doctor's expectancy was 56 to 58. Now that's still true. That is still true for doctors who are on the night shift. Okay. Emergency room doctors. Yeah. Those doctors only live to be 65.
Wow.
Some of them 56. Right.
Absolutely. Okay. Thank you so much, Patty, and your guest that you have there with you.
Yes. Thank you.
Thank you.
You are, sir. Yeah, give us a call every couple of weeks because you're going to have a great story. All right, Dr. Wallach, we're next going to go over to Rod, who has his hand up. And Rod, what question are you bringing in for Dr. Wallach today?
Hey, good afternoon, Doc. How you doing?
Yes, sir. How can we help you?
I've had 3 different calls from people that are dealing with seizures: an infant, an older lady, and a middle-aged man. What's relating or what's causing these seizures and these people? If you could help me out.
Well, it could be several things, but a middle-aged man, I believe he probably has osteoporosis of the skull and squeezing the 12 pairs of cranial nerves in the spinal cord, maybe also a version of the Friedreich's ataxia, having these seizures. You need to get a hold of the book or the flip chart. Actually, it's a flip chart. Okay. 90 for Life, crusade to save humanity and the world.
Okay.
Okay. And it goes into all these things, and he can say, oh, that's me, that one's me. Okay, and it tells you what to take. Okay. And like I say, we have, I don't know, about a dozen famous people. We're talking about movie stars, we're talking about athletes that have all these awards. Okay, we're talking about very rich people who are successful. We're talking about what should I say? I said movie actors, I think. And so it's one of those things where you have to look at these people. Why did they give us their pictures, and why are they telling their stories in this flip chart? Well, that's because all the best doctors they could find, and spending thousands of dollars on those doctors. The doctor says, we can't help you. And they came to us in weeks. Their problems went away in weeks. Okay, because they had osteoporosis of the skull. They had all kinds of things going on with the myelin and loss of the myelin in their brain and spinal cord. Okay. And so these are the sort of things that people who had Parkinson's disease for years.
11 years, and then the 12th year after being on your program for 2.5 months, Dr. Wallach, she no longer had the symptoms of Parkinson's. It's pretty incredible. In that flip chart, we've got testimonials where there's neurological conditions where there was unexplained twitching throughout the body. Also lungs, asthma. Folks, there's so many different things. As I mentioned, there's over 600 different poor health conditions linked to nutritional deficiencies. Over 600. So chances are what you are experiencing, even if it's been something from birth, because they can pass nutritional deficiencies through pregnancy onto the child, nutrition is going to be an answer that you want to give. Minimum 90-day try, because you are going to feel results.
Yeah, go to page 27. I think there's two printings, and one of them will be on page 26, and another one will be on page 27. And this is Melinda. Okay, I think that's her.
So it's Madeline, and that
Madeline,
is
Madeline.
A case study. We've shared some bits and pieces of a case study of the woman we just spoke about that had been diagnosed for 11 years with Parkinson's. So Dr. Wallach put her on a protocol, and hey, she just got better, Doc.
In 2.5 months, she was diagnosed as free. They kept running all the tests because they thought they were getting data from somebody else. But when they found out it was her data kept coming in, they said, we don't know why, but you don't have Parkinson's disease anymore. After 11.5 years, getting worse and worse and worse. And they told her family she was going to die, within a couple of weeks. And so that was several years ago now. And she's running around the world telling her story.
Absolutely, Dr. Wallach. And we love the fact that she allowed us to be able to help use her story to help others as well. All right, Doc, we only have less than 15 minutes, and I have about 40 questions here. Seriously. Seriously. So when it comes to, let's see, we're going back to blood sugar. My mother has diabetes, also dementia. Is it still worth taking supplements?
Oh, yes, absolutely. Take the 90 essential nutrients, get rid of all the bad foods, take the Healthy Brain and Heart Pack, take the Sweeties, take the I-26, and all those problems can go away.
So whether it's the blood sugar, whether it's dementia, supplementation can be very helpful, folks.
That's correct.
The next one, Mr. Appleskin says, hey, doctor, I'm dealing with rosacea on my nose. What can I do?
Okay, well, you need to get rid of all the bad foods, take the 90 essential nutrients according to your body weight, and then you need to take the Ultimate Daily Classic tablets. That'll get good circulation all over the body, whether it's your heart, whether it's your nose, whether it's your kidneys, whether it's your brain, whether it's your eyes, and whether it's your skin. And we also do have hair, skin, and nails. Wouldn't hurt to take hair, skin, and nails, get the circulation going through the skin also, in addition to the, let's see, what is it?
The Ultimate Daily Classic.
The Ultimate Daily Classic, yeah.
And also enzymes, Dr. Wallach. A lot of times, especially if we've been eating oats and the foods that we're not supposed to, we've got to get our digestive system working again. And the ultimate enzymes are very beneficial in helping with that, especially if you don't have a gallbladder. But it's not just for those who do not have a gallbladder. It is for everyone.
Yeah. Ultimate enzymes. I take 2 of those. I should take that back. I take 3 of those twice a day. The ultimate enzymes. I take them before the meals. So they're waiting for the food to come down there. You don't want to take your enzymes after you eat because they'll be chasing the food and never get it done right. So you want to take your enzymes, say 10, 15 minutes before you start eating.
Absolutely. And then if you forget your enzymes and you're after a meal and you're just feeling horrible, digest FX. That's the ticket. But prevention of feeling horrible is better than the being reactive. It's better to be proactive. Next statement is from Olga. She uses her spray bottle with the minerals as well. So thank you, Olga, for sharing that. So there's another person who says, so we're not supposed to eat the foods on the bad foods list, right, Dr. Wallach?
That's correct. You cannot eat the foods on the bad food list.
Because those are things
that'd be like throwing dirt from Texas into your gas tank of your car and wondering why it doesn't work. Come on, that's dirt from Texas. It's bound to have some gasoline in it. No. But there's, when you start doing silly things, that's what it sounds like. It's pretty silly.
So yes, it is very silly. So Shirley wants to know, Dr. Wallach, and let's just go over a protocol because we were talking about sugar today. She wants to know what would be the products for a diabetic senior to take. So if she's 150 pounds.
Okay, 150 pounds. Get rid of, I'm sorry, go ahead.
Let me just insert here. So as Dr. Wallach is giving recommendations, the way that the formulas have been packaged, they're packaged for a 30-day supply for a 100-pound individual. We go to up about, Dr. Wallach goes to about 140 pounds. So at 150 pounds, you're doubling the recommendation. That's why he says 2 brain and heart packs. So Dr. Wallach, diabetic senior, is it going to be different for a senior as it is for a young person with diabetes?
No. You have to get rid of the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, butter, oats, no buckwheat, no sugar, no carbonated drinks. Okay. Even the diet one's got to go. Then they need per 100 pounds of body weight, they need 1 healthy brain and heart pack or 1 healthy start pack or 1 healthy bone and joint pack, whichever one they need to use. And it could be for financial reasons or particular health problems. And then they need to take the I-26 for the brain and spinal cord to work properly. They also need to take the, let's see, for the heart, they need the Cardio FX. They also need the Ultimate Daily Classic tablets for blood flow into the brain, into the heart, into the kidneys, blood pressure, all that kind of stuff. The Ultimate Daily Classic tablet, it covers a lot of territory. I take 3 of those twice a day, Ultimate Daily Classic tablets. And I only weigh 142 pounds. And for snacks, we have our chocolate, okay? Just got a big supply in, okay? Triple treat truffles, okay? And just take a little package out. It comes 1 truffle per package there. And of course, I'm going to have 1 after lunch.
I figured you were going to open it right now and just tease us with it. But I love the longevity chocolate, Dr. Wallach, because 1, it gives you calcium. 2, it gives you pre and probiotics as well, in addition to those antioxidants that are naturally found in real cacao. So,
yeah, in the chocolate, yeah.
And it tastes good. It is low in sugar. Of course, people like their chocolates to be on the sweet side. So there's a little bit of natural cane sugar added in there to give a little bit of sweetness.
Yeah, you taste the chocolate, but it doesn't taste just like sugar. It tastes like chocolate, and it's a very unique flavor. And it's what should I say? It's about I don't know, a quarter of an inch thick, in the shape of a heart. It's really, really nice. And so,
Yeah, it's actually about almost a half an inch thick. That's pretty good sized chocolate there. Dr. Wallach, we've got some more questions. So James wants to know, there you go. James wants to know, what should I take with, oh, you're mean. Can you listen and hold? I thought that you were putting that in your mouth. Ready?
Yeah.
What should I take with tricep muscle soreness? He's 52 pounds or 52 years, 155 pounds. He has been taking the Start Pack and collagen peptides. What else should he be taking, Dr. Wallach, for the muscle soreness? My question is, did you just start working out, or has this been ongoing?
Okay, that's a good question. But in the meantime, we have our CM cream. He can rub that on his shoulder and also the triceps, which come down from the shoulder. Okay. And but also he needs to put it on his neck, and he needs to take the I-26 so his brain and spinal cord are working properly. He also needs I go with the glucogel. Make sure he's getting 3 of the glucogel 3 times a day to deal with the vertebral disc between the vertebrae, includes the ones in the neck. Okay. And because the neck afflicts the arms. Okay. There you go. And so there's a reason why you're feeling sore there. Okay.
And it may not necessarily be muscle. It could be a referred pain because of the nerves.
Yeah, it could have osteoporosis of the skull, squeezing that vagus nerve, that 10th cranial nerve, and that branch is being squeezed as it's coming out of the skull.
All right. Dr. Wallach, next. So Wendy writes in, she says, first, I'd like to say thank you. I've been taking your longevity products for 2 months now and have an overall feeling of wellness. Joint pain is an issue. Your bone and joint pack is amazing. She's also been on a subscription, a couple of subscriptions, blood pressure and for retention. She takes a vitamin D. She wants to know if the drugs are safe to mix with the pharmaceuticals, or if the pharmaceuticals are safe to mix with the longevity products. She has about 30 pounds to let go of, and no matter what she does, it won't come off. She says
here's the deal. The nutrients are just food. Okay, they don't they don't compete. That's the word I'm looking for. They don't compete directly with the pharmaceuticals. The pharmaceuticals are designed to relieve a symptom. The nutrients give your body what it needs to perform a function. Okay, there's a difference between a symptom and a function. Okay, and so if your function is improving, you can begin to reduce the medication. Don't just cold turkey off the medication, but reduce it by, say, 10, 15, 20%. Oh, man, this is wonderful. And then see what happens in the next week or two. Okay, and so you want to reduce your medication slowly based on the amount of reduction of the problem you had. And so as the relief of the problem is going down, you want to slowly increase your secret sauces. That's why I call them secret sauces. But you need full doses of the Healthy Brain and Heart Pack. You need full doses of the Healthy Start Pack or the Healthy Bone and Joint Pack, whichever one you want. But you need a full dose of that. And then the secret sauces come in. You do it at the same time. But there, we're talking about the Sweeties and the Ocean's Gold, and we're talking about the glucogel and those kinds of things. Okay. And so it's and the I-26, we need those things, and you can increase the dosage as you're getting better and decrease don't just cold turkey off your medication, but decrease it by, say, 10% or decrease it by 25%. And if you're still feeling better the next day, again, next week, you reduce it some more and so forth. And it may take you, that's why I say give us 90 days, because you should be able to get maximum benefit from an exchange from all drugs to reducing your drugs based on much benefits you're going to get from the 90 essential nutrients and the secret sauces.
And we do recommend that you do work with your primary care physician when you have been prescribed a pharmaceutical. We want to make sure that they are in awareness of what you are doing. And as your chemicals are working in the body, the supplementation makes them work better, meaning
Yes.
you're not going to need as much until you don't need them at all.
Now, here's a beautiful thing about what you just said, because what we want is that doctor to say, I don't know why, I've never seen anybody get rid of this problem. Well, I'm taking this. Let me see what you're taking. Okay. And he or she will begin to give that to other patients if they're honest, because if it's working for you, it should work for somebody else. It was truly what was going on. And so you'll spread the health information by sharing what you're doing if you're getting the benefit. And there'll be some doctors that just won't do it. They'll just say, well, stop taking all that nutrition stuff. Just keep taking okay. That translates to, I have a kid in college and I need the money.
Well, I have a couple comments on that, but when it comes to the weight that won't come off, Wendy, a lot of times when we're under a lot of stress, it raises our cortisol levels. And when our cortisol levels are high, that does limit us from being able to lose that extra weight because the body's kind of confused. There is a product that was brought in by the Life Force company that Longevity just recently acquired. It's called True Boost. It has adaptogens that help with balancing cortisol levels out. So I have started taking this. It doesn't taste bad. You want it like this?
Yeah.
Or like this?
Like that. There you go. True Boost.
Yeah.
There you go.
And it does come, this is a single dose. So definitely want to try that and see how that works for you. Now, Dr. Wallach, back to wanting you to stop taking pharmaceuticals. There's a recent publication that came out, Dr. Wallach, that has shown vitamin C to be beneficial in the cases of cancer. Tangy tangerine is loaded with vitamin C, not just vitamin C, but also all of the cofactors that the body needs to be able to properly process that vitamin C at the cellular level, folks.
Again,
so
which product is that?
Tangy tangerine.
I know. I just wanted to hear you say it again.
Well, which one do you want me to say? Because there's a tangy tangerine that is shellfish free for those that are having problems with shellfish. We've got the Tangy Tangerine 2.0, which has the pre and probiotics in it. We also have the 2.5 for those that have been told that they have an MTHFR mutation. We've got the 2.5 version of the Beyond Tangy Tangerine. We now have the 3.0, which breaks down the nutrients so that you have a morning dose, you have an evening dose, those nutrients that help work best as you are in rest, as it is called Restore. The other one is called Rise. I actually have them right there. We also have the originals, Dr. Wallach. We've got the Ultimate Tangy Tangerine, which is a concentrate. That's the one that I actually have taken most throughout my longevity experience because I was in the Pig Pack Plus. There's also the Ultra Body Toddy, which is another form of the Tangy Tangerine product. The Ultra Body Toddy has Cell Shield Blend in it, which I absolutely love what benefits that brings to the body as well. Again, that's Ultra Body Toddy. There's the Ultimate Classic, which was the original. Dr. Wallach, we're out of time. Actually, we went overtime. So I just want to thank you and a quick little shout out for an event that is being held this weekend on Saturday. If you want some more information about that, it is impact.dailywithdoc.com. As it is going to be a special presentation that is directed towards those in the medical practitioners of modalities, health
Rebecca?
and wellness, folks.
Rebecca?
What?
That's
Yes.
on Sunday.
Sunday. Thank you. That's why I have my co-host team. It's on Sunday, which is fantastic because that gives me 2 more days to prepare. But folks, we're going to have pharmacist Ben on there. I've got a special segment from Dr. Wallach that was pre-recorded that's going to be included in that, plus some others. You don't want to miss this. Share this with your friends and family, whether they're a chiropractor, massage therapist.
When is this going to be?
This is Sunday, Dr. Wallach.
It's coming Sunday.
This coming Sunday, it is going to be 2:00 Pacific time. But get all of the information by going to impact.dailywithdoc.com. You do have to register for it to get the link to join the Zoom. So, Dr. Wallach, I know you've got to go. Thank you so much for all that you do. I'm going to go ahead and release you. Have a fantastic day, Doc. We love you. We appreciate you so much.
Well, thank you. Thank you. We love you too. I can't thank you and the team enough, and thank all the callers for participating. God bless each and every one of you. Share the messages. Let's save humanity and the earth. We'll be back again. Bye-bye.
Absolutely. Many, many years to come, Doc. Bye for now. And if I could get my co-hosts up on the screen with me, I greatly appreciate them. As I couldn't keep track of everything all by myself, all of the questions that were coming in from YouTube, from Rumble, through email, here in the Zoom, it's just, I have to apologize for those that we did not get to. So please email us at questions@dailywithdoc.com. We will make sure that you do get answers to your questions based on Dr. Wallach's research and recommendations. He is the leader. He is the one that started this crusade. He's the one that did all of the research and was instrumental in the original formulations of the products that Youngevity offers. They have found value in other products that they have brought into that umbrella under Youngevity because they have things that maybe weren't there in the Youngevity family of products. And instead of trying to recreate the wheel, they found something that already was created, and they were able to bring that company and help build them stronger into the Youngevity family. So thank you, everybody, for being here with us, investing just over an hour into your own health for yourself, your family, your community. And as you're taking action, all together, we can make an impact and change how the world is. I mean, there's poor health all around the world. United States, I think, is probably one of the sickest, which is really sad because we have the most money going into our healthcare. But folks, when it's nutritional deficiencies, their pharmaceuticals are not going to fix you. They're going to mask the symptoms. So we invite you to give us 90 days. Give Dr. Wallach 90 days. Get back with the person that shared this program with you and say, hey, I want to try this at least 90 days. Okay? You're going to be feeling the difference. And as Dr. Wallach said, it's like putting gas in your car. You got to keep it going in order to maintain your body's ability to not just survive, but thrive. So today we have on with us Ruth Ellen, she is my executive production manager. Thank you so much, Ruth Ellen, for all that you do and helping us stay organized and get this Zoom put together and pushed out onto the different platforms. We appreciate you. We have Sherry, who is part of that, getting everything ready to push out to the different platforms. So thank you, Sherry, as you get that, help get that set up. We have AJ, who I don't think is on with us. He had to take off. He is responsible for getting those platforms available for us and set up so that we do and can push out to the different platforms. We have Marilyn, who is with us today as she is transcribing and typing super duper fast, and her little fingers at work here. She's taking lots of collagen and glucogel, folks, to help keep those muscles, tendons, ligaments, and osteoporosis from not affecting her body as she is doing this repetitive work. So thank you so much, Marilyn, for all you do. And we have Albert joining us from down in South Africa, and that is his friend that lives in his yard, that we call him Marty. He is here letting people in to the Zoom room. So thank you so much, Albert, as it is late at night for you. We appreciate you being here. And we also have Rod, who is here. He's out watching the different platforms, looking for those comments and questions and bringing them into the Zoom, and is our backup. So Albert's the bouncer. Rod is the backup bouncer when it comes to bringing people into the room and keeping an eye on stuff for us. So, you know, we greatly appreciate all of you being on your best behavior. You don't know how much we appreciate that as you are coming in and allowing it to be an environment where people can pay attention and learn. So folks, get back with the person that shared this program with you. If there is no one to thank, we have a call team standing by at 855-949-3377. Again, 855-949-3377. We have certified holistic health coaches that do man that phone line. But again, if you were referred by somebody specific, or if you're currently taking the longevity products already, get back with your longevity distributor. All right. We want to make sure that they are taking care of you, because that's what this business is all about, is helping others. And as we're helping others, we know that you'll start helping others as well. And let's work together to make a healthier world. My name is Becca Dukes. As the Director of Student Services for the Institute of Holistic Health, I would be doing you an injustice not mentioning the fact that we have a certified holistic health coach course that is open and available to everybody. Even if you don't want to be a health coach, this information is something that you can apply in your own world for your own health and the health of your families. 50% off right now, folks. It's already an affordable price compared to other programs that are out there. It is 1/10 of the price. And then you do 50% off of that. And oh my goodness, 1/5 of the price. You can become a certified holistic health coach. But most importantly, you can gain the knowledge that is needed to help you sustain a life to thrive. Get back with the person that shared this program with you. You can also sign up at Coach with Doc. That's coachwithdoc.com. And if you want the 50% off, give us a call, 855-949-3377, as there is a special discount code that is being offered through Christmas. After Christmas and after the first of the year, it will not be available at 50% off. So give us a call. 855-949-3377. Visit the website, get that good foods, bad foods list so you know exactly what should and should not be eaten and why. We have the why on there as well. And also check out some of our other programs. Like and subscribe if you are on any of our platforms. Make sure that you're following us. And most importantly, share it. We do this so that it can be shared and used to help create a healthier world. Tomorrow, we do have with us pharmacist Ben Fuchs, as we're going to be bringing more information, going a deep dive into some specific health concerns that our listeners are reaching out to us about. So have a blessed day, everybody. And we'll see you next time on Daily with Doc. Bye for now. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.